Hello, everybody. I will just wait the confirmation that you are able to see me. So I'm Sebastien Lobet. I'm physiotherapist in Brussels, working in Clinique Universitaire Saint-Luc. I'm happy to show you this Facebook video on the exercise for the knee. So it's a collaboration between EAHAD and EHC, and so we just wait confirmation that you are able to see me. Okay. Okay. So, as I said, I'm Sebastien Lobet, physiotherapist working in Clinique Saint-Luc in Brussels, Belgium. And I'm happy to show you some exercise for the knee. As you know, the knee is one of the most affected joints in patients with hemophilia. And before to start to show you some exercise, I think it's important to re-explain you some basics of anatomy and biomechanics. It's very important for you to understand the functioning of the knee. So this is the knee, as you can see, and we say that the knee is an hinge joint, and so because the knee is able to bend in flexion and extension. As you can see, if we look at the anatomy of the knee, it's constituted of different bones. This is the femur, as you can recognize him, because it's the longest bone of the body. And this is the tibia. So the knee is really a connection between the femur and the tibia. And in fact, into the knee, there are two joints. There is what we call the tibiofemoral joint, which is responsible of movement of flexion and extension. And you have also what we call the patellofemoral joint. So this is the joint between the patella, so the kneecap, you can see here, and the femur. And basically, the patella will glide on the femur during the movement of extension. This patella is very important because, as I will show you, there is muscle that will activate the joint, and this little bone is responsible to increase the level arm of the knee. So it increases, in fact, the strength and the link between the femur and the tibia. You have also this bone, what we call the fibula. The fibula is not really supporting a lot of weight, but roughly 10% of the weight, but is a piece of bone where a lot of muscle will be attached. So the fibula is really important. So that's the four main bones of the knee. So the femur, the patella, the tibia, and the fibula. And you have to know that the knee is really very vulnerable to a lot of injuries, because you can have direct contact. If you fall, for example, on your knee, you can, as an hemophilia patient, you can easily have an hemarthrosis because you have a direct contact of the knee on the ground, for instance. And the knee is also a joint that will support a lot of mechanical stress. For example, if you are walking, just normally walking, you are supporting 1.5 times the weight of your body. But if you do another activities, for example, if you climb stairs, you increase your body weight by 3 or 4 times. And for example, if you do squats, so exercise that I will show you just afterwards, you will your knee will support roughly 8 times the weight of your body. So this is really a joint that is that will sustain a lot of pressure. I show you the bones, but you have to know that around the bone there are also ligaments that will maintain the stability of the joint. Because, as you can see, The movement of the knee is a movement of the condyle on the tibia plateau, okay? And if you can see on the anatomy, this is not really a very stable joint. It's not like the hip, which is very stable. The knee is not very stable. So it has to be maintained by different ligaments and muscles. You have the lateral ligament, you have the medial ligament, you have also ligament inside the joint, what we call the cruciate ligament, anterior cruciate ligament and posterior cruciate ligament. For example, these ligaments are very important to prevent movement of torsion of the knee. And for instance, if there are a lot of accidents by skiing or football, and this ligament, the cruciate ligament, are very often damaged by injuries in sports. So these ligaments are very important to maintain the stability of the knee. In addition, around the knee, you have what we call the joint capsule. The capsule is a tissue that will really maintain everything together. And inside this capsule, you have the synovial tissue. You know that the synovial tissue is a tissue that will produce a liquid that will lubricate the joint. So inside this capsule is very firm and it maintains really the joint all together. And if you are a patient with hemophilia and you are bleeding into the joint, this bleed will be maintained into the capsule, so it doesn't go outside. So that's the reason why when you have an hemarthrosis, you cannot see a bruise, for example, on your knee, but because the blood is completely maintained inside the joint because of the capsule. Okay. Last but not least, between these two bones, you have also the meniscus and the cartilage that will be damaged. If you are bleeding a lot into the knee, the blood will progressively destroy the cartilage, and you will see a diminution, a narrowing of the space between the two bones because the cartilage will progressively disappear. We will discuss about the muscle later on when I will show you some exercise. Just to re-explain you the symptoms that you can feel as an hemophilia patient, the symptoms that you can feel into the knee if you have a damage. One of the most common symptoms for patients with hemophilia is swelling. You can feel that your knee is swelling because there is liquid inside the joint. So this liquid is maintained inside the joint capsule. This liquid is not necessarily blood. If it's blood, it's an hemarthrosis, but in most of the case, if you have an osteoarthritis, the liquid inside the joint will be inflammatory liquid. And as a physio, as a doctor, we really have to differentiate between this kind of liquid, because if it's blood, the first treatment to do is, of course, to inject your factor, replacement factor, is to put ice, so the RICE concept, rest, ice, compression, elevation, okay, and to adopt a rest, very important. But if it's liquid due to inflammation, then the treatment is more anti-inflammatory drugs or physiotherapy, okay? One of the common symptoms is also pain and sensation of giving way. So sometimes patients with osteoarthritis can feel that the knee is going on just because of pain, okay? So now we will start with showing you some exercise. So I will try first to show you some exercise to mobilize the patella. So when I show exercise, there are three main kinds of exercise. Exercise that will improve range of motion, so the movement. It's really important because movement is responsible of walking, for example, of climbing stairs. If a patient has not enough range of motion, for example, he will not be able to bicycle, because for bicycling you need at least 100 degrees of flexion, otherwise it's impossible to bicycle. So it's really important to regain a little bit of movement, whatever in flexion or in extension, in order to improve his function. So range of motion, strength. So I will show you some exercise for strength to regain some strength in the muscle, and also proprioception. Proprioception is balance. Balance, this is very important in order to prevent falls, for example. So I will start to show you some exercise to regain range of motion. So these kind of exercise are really easy to do. You can perform them whatever you have a severe arthropathy, whatever you have, for example, a total knee replacement, or even if you are a young hemophilia patient or just a sportman like me, it's really nice to do this exercise quite very often to improve range of motion. So the first exercise I will show you is an exercise to mobilize. The first exercise is an exercise to mobilize the kneecap, so the patella. So it's very simple, but it's very important, because if your patella is very stiff, your knee will not be able to move a lot. So the basic things to do is to take your two fingers here, to put them on the patella, and to try to move the patella from the left side to the right side, like this. And you have to try, very importantly, to put the most of surface on your patella. If you push just with the tip of the finger, you will increase the pressure on your joint. So try all the time to increase the contact, the surface of contact with your patella, in order to reduce the pressure on your joint. Principally, if you suffer from an arthropathy, it's really important. So this is the first exercise. I try to move my patella from left to right, and I try progressively to increase the range of motion. You try to do that for a couple of minutes. Then you try to do the same by pushing down and pushing up the patella, like this. Very important, I forgot to precise. If your knee is a little bit bent, the patella will not move, because the patella is locked into the joint. So this exercise is only possible if you have almost a full extension of your knee, and if your muscle, your quadriceps, is relaxed. If you are contract, just try to do like this. If I contract my muscle, my patella is unable to move. So I really have to relax, and I will try to move my patella from left to right, up to down. Okay? And then I can do circle. So this is a very simple exercise, but very important. The next exercise to do is, after mobilizing the patella, is to mobilize your tendon. You can see that here you have a big muscle, the quadriceps muscle, which is attached to the patella by a tendon just over here, what we call the quadriceps tendon. And just below the patella, you have a big tendon, which is the patellar tendon. So what you have to do, again, you have to relax your knee, and then you have to try to mobilize your tendon from left to right. I hope you can see me. I will try to do it just up to show you. You can do that also upwards, like this. And you try to mobilize your tendon from left to right. The same for the quadriceps tendon. Okay? This is very simple to do. Then what you can do also is to push. I will do it on the table for better visibility. What you can do is to push on your tendon, to do like a massage, and then at the same time you try to bend. So you pull, and then you try to bend your knee. By doing that, you will stretch your tendon. So I do it for the quadriceps tendon. I will do the same for the patellar tendon. So patellar tendon, okay, I do massage, and then I maintain the pressure, and then I try to bend my knee. Okay, so these are very basic exercises to mobilize the patella. It looks very simple, but for people with a stiff knee, it's very important, and you have almost no chance to have a bleed by doing this kind of exercise. Okay, so it's like a nice indirect mobilization that will permit to regain range of motion. Okay, so very important. Then we will focus principally on exercise to regain range of motion, for example, in flexion. First exercise, very simple. You try to be seated comfortably. Okay, like this. You take a pillow, very comfortable. You bend one leg, and then with the other leg, you try to bend as much as possible, and then you re-extend. I bend my knee as much as I can, and then I re-extend the knee as much as I can. So the idea here is not to try to focus on flexion for 2, 3, 4 minutes, it's useless, but to move from flexion to extension and progressively increase what we call the range of motion. Because if you gain in flexion, for example, if I train my flexion for 5 minutes, I will lose in extension. If I train my extension for 5 minutes, I will lose in flexion. So the idea here is all the time to do a very dynamic exercise and to go from flexion to extension. Okay? For people for which it's easy, you can increase the flexion by using a towel. Okay, like this, very simply. And what I will do, I will increase my flexion with the towel. Then I fully re-extend. And then again, I try to increase flexion with the towel. Okay? Very easy. You can do it with the heel all the time in contact on the table, or you can lift up the heel without any problem and you try to force a little bit in flexion. Okay? But without any pain. If you feel some pain, just go slowly, don't take any risk. Let's move on to other exercise. Very important exercise. You can also do it seated. For example, I'm seated like this. I will try to move a little bit the camera like this. Okay, it's better. Then I will show you with this leg. What I can do, I'm seated, and I will use my weight to increase my flexion. So I'm just on the border of a table or whatever, a chair, and I will do is to bend forwards and progressively to try to increase the flexion of my knee. I go back. Again, I increase the flexion of my knee. Okay, I can show you on the chair. It's maybe easier. Okay, I will show you with this leg. Okay, and progressively I bend forwards to increase the flexion. Again, I try to re-extend a little bit my leg. I will increase flexion again to re-increase the flexion. Very easy. So that's basic exercise to increase the flexion. Now, if I told you, if I gain in flexion, I will lose in extension. So I need to retrain my extension as well. Principally, if you're a patient that has been operated of a total knee replacement, you know that most of the time your knee is not fully extended because when you put a knee prosthesis, you replace the joint, but you do not replace the soft tissue around the knee. So you do not replace the capsule, you do not replace the muscle, the tendon, and this muscle, this tendon, this capsule is fibrotic. So what we need to re-stretch it. And the only way to do it is to do regular exercise. So one of the best exercises I will show you, I will take the example of a patient who has a slight knee flexion. What I can do is to just put my heel on a chair. So I'm watching TV, I'm relaxed in the sofa, and I will try to do a posture of extension for a couple of minutes. What you have to do is to feel a sensation of stretching. Sensation of stretching for a couple of minutes, then 1-2 minutes, and then you reflex a little bit your knee. Okay? Again, you can increase the stretching by pushing gently on your thigh. So with my two hands, I push slightly. Okay. What I can do also is to increase the tension by doing a dorsiflexion of my ankle. Okay. Again, I can push. So the rule here, this exercise is a posture. That means that if you do it with too much intensity, you cannot stay in that position for a couple of minutes. So you have to feel a slight stretch, but it has to be constant. And you will feel with the time that your knee will progressively extend more and more. Again, I will show you with this towel, I can again increase my extension by asking an extension of my quadriceps. So I contract my muscle here to extend my knee. So very important exercise to regain the extension. If you are more advanced, you can do it also on the table. Enfin, you can lie on the table or lie on the mat, on the ground, for example. And what you can do is progressively, you are in this position and you will try to extend your leg. You can pull with the towel for progressively increase the extension. What you can do is to do also active exercise by doing extension of your leg. So what I do for the moment is stretching exercise, but dynamically. Instead of holding the position for 30 seconds, I do the exercise by doing an extension of my knee. And if you repeat that for a couple of minutes, you will see that you will progressively increase the extension. For most of the people, sometimes this kind of stretching is more comfortable in comparison with the passive stretching. So the passive stretching is basically to hold the position for 30 seconds and then to relax. But for some people, it can be painful. So because at the same time, you stretch the nerve and all the soft tissue. So the solution maybe is to do this kind of active exercise. Very good exercise. Okay, let's now move for some exercise to increase the strength. So before to speak about strength, I have to explain you what are the main muscles present in the knee. The big muscle here is the quadriceps, and it's composed of four parts. And if you contract your muscle, you will see the vastus medialis and the vastus lateralis. Okay, and then at the back of your leg, you have the hamstrings. It's in fact three muscles: semimembranous, semitendinous, and biceps femoris. Whatever. Just keep in mind the quadriceps are responsible of the extension of the knee, and the hamstring are responsible of the flexion of the knee. Okay, so to retrain the quadriceps, basically what you can do is, for example, to ask an isometric contraction of your knee, of your muscle. So what I can do is to put my hand under my knee and to push, and to try to push as much as possible. You can see that my muscle here is contracting, okay? Because it's a non-isometric muscle, you have almost no chance to injure yourself because there is no movement into the knee. So less chance to have a bleed. So this is a very safe exercise. So, okay, full extension, you try to hold for 20 seconds and then you relax. Okay, you do it again, full extension, you contract, you contract, you contract, you try to push as much as possible and then you relax. Very safe exercise. If you want to increase the difficulty, but not too much, you can ask, I can ask you to, for example, just extend your leg like this and relax. So this is more an active exercise to strengthen the quadriceps. Okay, and relax. Extension, you hold the position for 5-10 seconds and then you relax. If it's too easy for you, you can use the other leg to use it as resistance. You put it on your ankle as a weight and you try to, again, to lift your leg like this. Extension, you hold the position for 5-10 seconds and then you relax. Very good exercise. Next one. You will also need to strengthen what we call the hamstring. The hamstrings are muscles that are more difficult to strengthen. So a very basic exercise to do is to do the bridge. So both legs like this, and you try to lift up the belly up, and then you relax. I can do it on the complete flat positions. It's even better. Okay, like this. And I try to lift my pelvis up until it's completely straight. You will feel the tension in your hamstring, and then you relax. Okay, up, and you relax. You can do that plenty of time. It's not very harmful, it's not so difficult, but you will see that it works very well. Then, to finish this session, I will show you some exercise that will strengthen at the same time the quadriceps and the hamstring. It's what we call the closed kinetic chain exercise. So this is an example. The squat, for example, is an example of closed kinetic chain exercise, because this exercise, what you need your quadriceps to lift up, to extend your knee, but you need also at the same time a contraction of your hamstrings, because you need to stabilize your knee. So if I do that kind of exercise, you can see that my hamstrings are at the same time contracted. So this is a very functional exercise. But I know that some patients can fear at the beginning to do that kind of exercise. So I will just show you some progression. Very easy to start. You can be on a chair, or you can be on the table, you can be seated. And then what you can do is to lift up, and then you sit down by slowing down. Okay, and then sitting. Lift up, slow down, and sit it. If it's fine, if it's easy for you, okay, no problem. You lift up, you sit down, you just touch barely the table, and then go up. Like this. You increase the resistance, okay? If you are a young people, you are even more confident, very easy. Then you can realize what we call a squat, and you do not need any more. You can start, for example, with if you're not sure, you start with to hold a chair, you go down, and you go up. And you go down not more than 90 degrees of your knee. Okay? So go down and go up. If you feel comfortable, you remove the chair, and then this is the most difficult exercise you can perform, what we call the squat. You go down, you go up, and you can use your arm. This is a very good exercise to also improve the resistance. You can improve the aerobic capacity, and I can tell you that if you do that many times, you will definitely feel it in your heart. So you train your endurance at the same time. Very simple exercise, very functional, and this kind of exercise are very useful in your daily life, because you will use all of the time this kind of exercise. So this was the last exercise for strengthening. Still one. If you feel comfortable, I will show you then. The next exercise is to train the balance. So to train the balance, what I can do, balance is really important to prevent falls. So what I can do is I'm just on one leg, okay, like this. And what I will do, I will delock slightly the knee. You can see that my vastus medialis is contracting, and I will hold in balance like this on one leg. Only if it's possible for your ankle, of course. Okay? If it's not possible, you can maybe hold something and you just try not to bend too much and you try to stay in balance like this. You feel comfortable, okay, you bend a little bit your knee, you can use the other leg to destabilize your knee. You can see that it's even more difficult. What you can do is also to close your eyes. If you close your eyes, you move off the visual, and so it's even more difficult. Last but not least, I will show you an exercise that at the same time strengthen the quadriceps and increase the proprioception. So what we'll do, it's a fence like this. Okay, you can start with some by holding something to improve the balance. And what I will do is to flex my knee, go up, flex my knee. So at the same time, I will train my balance. Last but not least, if I feel good, okay, I remove it and I retrain my balance like this. Okay? You can start, you can do it with one leg, then you change the leg, and you can do it progressively. So I think I'm just on time now, and I hope you can see that I have some difficulties to breathe, so it was quite challenging for me. I hope you enjoyed this exercise, and yes, it was the second video. The first video was launched by my colleague David Stephenson from Kent. It was exercise for the ankles. This was a second video for the knees. And then my other colleagues, Marie, will, during the next month, show you some exercise to improve the range of motion, to improve the functionality of your elbow. So I hope you enjoy this video, and do not hesitate maybe to send me an email or to send an email to EAHC if you have any question. Bye-bye, everybody, and do not forget to do a lot of sports during this lockdown period. It's very important to continue to move, and I hope you will do exercise and sport as much as possible. Bye-bye, thank you.